sign and symptoms and the mode of transmission of the first wave was different. As we just discussed, the mode of transmission was usually by aerosols, by coughing and sneezing. So we have been told to have all the precautions so that we don't fall victim to a cough-produced virus in anyone by social distancing and masking. And the symptomatology was also very different. They had only fever, cough, they had loss of smell, loss of taste, body aches, headache. This was the common mode of presentation of the first virus. But the mutation virus is very different. It produces sore throat first, and then fever, then headache and body ache. And a lot of patients with this mutation we are seeing having persistent diarrhea. I remember I've seen 2-3 patients who had a rash in the body, conjunctivitis, because of the vasculitis produced by this virus. So the mode of presentation is different. As you rightly mentioned, that there is a lot of data that this virus is highly infectious and also airborne. So we have to be more careful, especially in elderly people and those who are compromised immunologically. We should be very, very careful, and I think time to act is now. Stay at home. Don't step out of the house until unless it's really essential. Is a very important message to prevent the mode of spread, because it spreads like a fire when we stay in a crowded place, like processions or parties or social get-togethers or anywhere like Kumbh Melas or rallies. We should not have any big conferences. Everything should be digitally performed. Perform from home. Use digital media. Use television, Zoom, or use various WhatsApps or video consultations, telemedicines. So the time has come. We have to reduce the modes of spread. And we have to have a different lifestyle, what we call as COVID lifestyle. That may really help us to reduce the rising menace of COVID in our country as well as globally. One should be very, very careful with this mutation of the virus. As I mentioned, it is highly infectious. Don't go to social gardens. I'm very fond of going to Lodi Garden. I used to go every day, and I used to go in the hours like morning hours when there's no rush. One should avoid, especially in the second wave, because the virus is in the air. You asked a very pertinent question. Should we go to balcony? Should we go to the terrace? I think we should be very, very careful. If you are compromised immunologically, and if you have some ailment or comorbidities, or if you are a very senior citizen, you have to be very, very careful. So far as children is concerned, their immunity is good. They can easily go to terrace or balconies, but for elderly people or middle-aged people with comorbidities, we should be very, very careful. I personally believe that stay at home and don't get out of your house at least for 1 month to reduce the morbidity inflicted by this virulent virus. It has got a very high virulence and very highly infectious. So when we know these two components of this virus, why should we commit a mistake? Why should we fall victim to this COVID virus? I think the message is very clear. Stay at home as much as possible.